going to discuss about community empowerment and its value in assisting countries to produce good health outcomes. And I'm going to base my presentation on Sri Lanka. Sri Lanka is an island nation which is in the Indian Ocean, and I will use Sri Lanka as a case example to illustrate how community empowerment can contribute to produce good health outcomes. To give you an idea of the health status in Sri Lanka using the conventional health indices, we are a country having a per capita income or GNP, gross national product, of US dollars 3,280, which places Sri Lanka as a middle income country. As you know, the countries are classified according to their national income to as high income and middle income and low income countries, and Sri Lanka is is identified as a middle income, low middle income country. So despite Sri Lanka being a middle income country, even before we became a middle income country, we had achieved quite advanced status of health. When you look at the health indices, particularly if you look at the life expectancy at birth, which is high, for males it's 70.5 and for females nearly 80 years. And if you look at the infant mortality rate in Sri Lanka, now it's single digit 9.7 per thousand live births, and also the under 5 mortality rate, which is 12 per thousand live births, and also the maternal mortality rate is very low compared to the neighboring countries in South Asia. We have a maternal mortality rate of 22.3 per 100,000 live births, and also our literacy rate is very high. And I'm going to discuss how we made these achievements from a historical point of view. Look at how these indicators fared during the period from the independence. Sri Lanka gained independence from the British in 1948, and if you look at the historical timeline, the crude mortality rate declined, and our fertility rates also declined, and you can see the per capita income was quite low in the 50s and the 60s. So despite the per capita income being low, we were still observing a declining trend for the key health indicators like maternal mortality rate, the infant mortality rate, and even other indicators which are not depicted in this picture. So there are many theses presented how Sri Lanka achieved this impressive health status when you look at these indices. I, as a community physician and also as a social activist, see it in a slightly different way. I would not attribute this success exclusively or even primarily to the health service delivery. To start with, we had a socio-cultural environment or a socio-cultural milieu which was based on largely the predominantly Buddhist ethos, because Sri Lanka has a majority Buddhist population, and also the traditional behavior patterns of even other communities living in Sri Lanka, not just the Sinhalese, the Tamils, and also the Muslims. And generally they were health conscious, and there was a very positive consciousness towards promoting health, and people were concerned about illness and sickness, and they took precautions. And then we also had a democratic system. Even before we gained independence in 1948, under the British, we gained universal franchise, that every Sri Lankan could vote. Every Sri Lankan over 21 years of age could exercise vote, and that included women as well. So from a very early stage in the evolution of the governance system in Sri Lanka, the people had the right to vote, and using that democratic mandate, people were able to really have a representative form of government where they could lobby for better health services, better health care, and if the elected officials didn't deliver, then they could easily change the governments. So I think the fact that we had a vibrant democratic system also contributed towards people being able to demand services from the state, from the government, and hold the elected representatives accountable for delivery of these services. Within that larger context only, I see the healthcare system being evolved, and also there are two other elements. One is of course I think we have shifted to the other slide, but the third element in this framework is free education and subsidized food. Sri Lanka has a universal free education system which was initiated in the 1940s, and Sri Lanka's population was very much inclined towards better education as a means for going up in the social ladder. So because of the willingness of the population to really pursue higher education, they always regarded education as a sacred thing, and also really wanted to educate, the parents wanted to educate their children even though they were probably coming from very poor families. So they thought that education was a means to get out of poverty. So this was supplemented by subsidized food through the government, because there were rations. Rice ration was there, flour ration was there. So for low income families who were suffering from malnutrition and so many other challenges were able to sustain themselves and at least have a decent life because of free education, free healthcare system, and subsidized food. However, despite these achievements, when you look at the national averages, they are very impressive. However, this map shows the food security status in the different districts and sub-districts units of Sri Lanka. Though this map is little bit old, it's in the early 2000s this map was drawn, but this situation hasn't significantly changed. When you look at the food security in terms of people having access to quality food and in adequate quantity to fulfill their caloric requirement, we see lot of disparities. Some areas which have been also affected by the internal armed conflict has fared very badly. And there are certain areas which are quite good. As you can see, the red colored areas are households which are having food security. Then the blue areas are where it's not that bad, but at the same time it's not satisfactory. So you get a mix of geographic locations in the same country which has achieved a lot in health, but showing these disparities. Now if you move on to the next slide, you can see even though the infant mortality rate given as a national average, which is shown here in yellow, but if you look at the 25 districts of Sri Lanka, some districts have even nearly 2 times the national average for infant mortality rate. So this is unacceptable. So we can't have such disparities in a small country like Sri Lanka. So this is our challenge. Now, I'm looking at the low birth weight. The next slide is the infant mortality rate. It's the same pattern. So even though the statistics can be now updated for recent times, the pattern hasn't changed. That's the most important point. So to compound this situation, if you move on to next slide, you will see Sri Lanka is a country which has been having an armed conflict for nearly 26 years. Starting from early 1980s, we have had a separatist movement which was demanding through an armed struggle a separate state in the northern and eastern parts of Sri Lanka. So it was a very intense and very bloody armed conflict, which claimed the lives of very large number of people. Nearly 100,000 people lost their lives, and these people were largely civilians. But not only civilians, we had combatants from the security forces of the government. Nearly 20 uh, 3,000 odd service personnel got killed, and about 60,000 wounded, and these are young people, uh, two generations, and some of them became permanently disabled. Then on the side of the militants, the separatist group, they were all young people, and some were even child recruits, child soldiers. 27,000 got killed. And when the war ended in 2009, May 2009, nearly 12,000 combatants, even underage combatants, were surrendered or taken into custody. And there was tremendous impact, particularly on the two provinces. About 8 districts lost a lot of their infrastructure, including health facilities and schools and government service centers, and tremendous impact on property and people's livelihoods and housing. So, but the most important thing is this war ended not through a negotiated settlement, but through a comprehensive comprehensive victory by the security forces, the government forces. So we are dealing with the aftermath of the war now. The war ended in 2009, so now we are in 2000. There are additional challenges that our health system and the country is facing in relation to dealing with the aftermath of the war. So, if I may summarize the health challenges that we face now, the first is, of course, the set of issues arising as a result of the demographic changes that are happening. As I mentioned to you earlier, the fertility has been declining. We almost hit the replacement fertility level of 2.1, and as a result, we have a adolescent health population. Our base of the population pyramid is getting narrower, and also the elderly population is increasing. We are one of the fastest aging populations in the whole of South Asia, and our healthcare delivery system is still not geared to provide geriatric services. We have only a few geriatric specialists, and more than that, the entire system, which has evolved mainly to cater to the needs of the maternal and child health areas from the different health needs in the sector, hasn't still been able to really come up with a system to meet the demands of an aging population. Then, although we have come a long way in addressing malnutrition and other nutrition related problems, we still get pockets of geographic areas and communities where protein energy malnutrition is at a higher level, and also micronutrient deficiency, particularly iron deficiency anemia, is prevalent amongst the pregnant women. So we haven't still really overcome malnutrition and also undernutrition. At the same time, we are facing, because of the epidemiological transition, obesity is also now becoming a problem, also amongst the younger generation, particularly the urban youth and young children, because of the wrong food consumption patterns that they are now exposed to. Then, of course, we have the disease pattern, which was earlier dominated by infectious diseases or communicable diseases, now shifting to more non-communicable diseases like heart disease, hypertension, carcinomas, mental health diseases, and so on. So at the same time, we are also facing a kind of an unusual public health problem called chronic kidney disease of unknown etiology, CKDU, which is seen in mainly in the farmers living in the dry zone. We have a geographic area which is identified as a dry zone because of the low rainfall, and they are largely farmers who do farming based on the on monsoon rain, and we believe that this kidney disease, which doesn't have a identifiable cause, we know the known causes are diabetes and hypertension and so many other specific diseases. These patients who are affected by this particular form of kidney disease don't have an identifiable cause, and we are suspecting it to be due to heavy metals as a result of extensive use of agrochemicals and chemical fertilizer. That is pesticides and also insecticides. Then we also have dengue and dengue hemorrhagic fever, which has been on the increase. And this year, 2017, we have a huge problem, and this mosquito Aedes aegypti is causing this dengue epidemic, and the mortality has also been high. So this is a major health challenge in Sri Lanka now. Though war ended and war-related deaths are now zero, we get other forms of violence. And if you study countries affected by an armed conflict, always have to deal with an aftermath of sometimes gang violence and so many other forms of violence because of proliferation of small arms. So we have seen that as well, and also road traffic accidents and house injuries have also been on the rise. Then unfortunately, we also have seen a rise in child abuse. This is also linked to another migration pattern. There are economic migrants from Sri Lanka, particularly young mothers, going to the Middle East, leaving their young children behind, and they are being abused because there is no proper child protection in Sri Lanka. Then, as I mentioned earlier, the war had a big toll on lives and livelihoods and people's, there is trauma, and there are especially psychological trauma. We also see PTSD amongst the former combatants. So this is also another important area that we have to deal with. Then mental health problems, not just war related, but other problems are also there, and substance abuse, which are also the tobacco, alcohol, and drugs. So these are the key health challenges that Sri Lanka faces today. So in this context, how do we view community empowerment, and how can we then use community empowerment to address some of these challenges so that we can maintain these good health outcomes that Sri Lanka has historically produced? So I still believe that despite these challenges, even if you look at the mortality, morbidity patterns, we are facing a huge challenge, but I'm still convinced that we are still a model for achieving good health at low cost. Even being a middle income country now, I think the delivery of health services and access to health services, when you look at the universal health care framework, all indicators direct us to places us as a country which is performing well. However, disparities are a major concern. So we believe that in order to address these disparities, people need to be much more engaged in the delivery of healthcare services. So now, in order for people to be more involved, we also need to have the health sector itself being more responsive than before, because to address disparities, you need the community and the health system and other stakeholders to work together as a team and find solutions together. There we see some major challenges. One, of course, is governance, because the governance system of the healthcare delivery system has always been top down, and it's a bureaucratic structure. Because it's a free healthcare system, the doctor is always making the decision, and the patient is not really empowered. So it's a kind of unequal relationship. So the governance need to be looked at again. And we also see some negative trends in the healthcare system now, where the doctors are taking trade union action to win their rights or to protest against certain government policies like privatization of medical education and things like that. So we have a bit of a crisis of governance in the health sector. Then we also have, although we have a free healthcare system at the point of delivery, and still it's a huge relief for poor people who cannot afford healthcare in the private sector. There is a lot of the level of expenditure on medicines and laboratory tests. Even if you obtain your treatment from government hospitals, is high. So that is what we call out of pocket expenses. So the level of, or the percentage or the proportion of out of pocket expenses is high in Sri Lanka. Then the private healthcare system is flourishing, and it's also expanding even to rural areas now. It's not just the private practitioners, the general practitioners who do private practice, but also the industry, the private hospital industry, which has been located mainly in Colombo and the rural areas in the country, setting up laboratory services, collection centers, and so that is really becoming a challenge because of quality control. There's no price control, so we believe that people are being exploited. So this is a challenge. Then the crisis in medical education, I referred to that. That is, we have a education system which is dominated by the state. We don't have private universities, and in particular, the medical education is exclusively given in state universities, and there has been resistance from various quarters for medical education to be privatized. So, but despite that, the former government gave permission to start a private medical school, and the students in the state medical schools and the government medical officers or doctors are protesting against this. So now we have a crisis situation where for the past 8 months all the state medical schools are closed down because they are boycotting classes until the government takes a firm decision, and what their demand is to close down this private medical school. Then finally, health financing. The free healthcare system is based on taxation, so the government has to increase tax to provide better services, and even the treatment and drugs and all that is now becoming more expensive. So then we go to the next slide, where we look at the recent developments. Now, those of us who have been civil society activists and also leading movements like the People's Health Movement (PHM), which is a global movement, and we have been a part of PHM from Sri Lanka, and we were trying to include health as a fundamental right in our constitution. Although healthcare in Sri Lanka is free, it's really not a constitutional right. So we have been lobbying, doing a lot of advocacy work to get health included as a fundamental right in our new constitution that is being formulated. After the present government came into power in 2015, one of the promises was that we come up with a new constitution that would also address part of the root causes that led to the war in Sri Lanka. So we have been lobbying for that as well. And then the Right to Information Act is a very important tool for community empowerment and civil society mobilization. Now here we have a citizen has an access to government confidential nature, which are connected to national security or people's private lives. Other than that, we can get information from the health ministry or a hospital as to, for example, the availability of drugs, the availability of personnel, and also about procurement, whether there are any malpractices, and all that can be watched by citizens groups. So I think we have entered into a new era where the Right to Information Act is being now legalized, and the citizens can use that, and we as a civil society organization are also now having a lot of road shows, going into communities and explaining them this act is in place now, and you all can ask for information from your local authorities, local health authorities, and from schools and all that. So this is really an empowering tool for the people. Then we also have some international commitments that have been made by the government of Sri Lanka, which can also be used by citizens to hold the health system accountable. One such example is what you call the Open Government Partnership, OGP. You can look at the details in the link that is given in this slide. So the health sector in Sri Lanka has committed. In the next slide, you can see the commitments of the health sector. First is improving public access to preventive and curative strategies to combat chronic kidney disease of unknown etiology, which I mentioned earlier, which is affecting hundreds and thousands of farmer families in the country. Second commitment is to have a transparent policy to provide safe and affordable medicines for all. Even though the system is free, the healthcare system is free, people still can't afford some of the medicines that have been prescribed by even the government clinics and hospitals. So recently we have seen essential drug policy being implemented, and also much more transparent procurement processes to make the essential medicines affordable by the people. So that's the second commitment. And the third commitment is to come up with a national health performance framework. So each level of healthcare delivery will have to come up with indicators, key performance indicators, KPIs, which can be also monitored by citizens. Even though there are performance indicators that have existed for many years, internally for administrators to take decisions, they were not available or accessible by the people. So in this new commitment that government has made, ordinary citizens can really look at the figures for those indicators. So going back to the previous slide, the other important development has of course been Sustainable Development Goals, which came into being in 2015, and all the governments in the world have committed to this, and health is one of the Sustainable Development Goals, and universal health care has been identified as an essential component of sustainable development, and we can use that also for community empowerment. So going to the last slide to conclude. So today's context is vastly different and further complicated by globalization and climate change. And as I have mentioned earlier, private sector has creeped in to the health in Sri Lanka in a big way, and the state sector is still the dominant force in Sri Lanka, but it has to negotiate for various things, both with the other stakeholders, but more importantly with the community. So here there is a need for a new compact, a new social compact between the community, the citizen, and the healthcare system. So we see that happening now, and also of course with the climate change we are facing new challenges, and incidentally, as I speak to you now, my organization is involved in providing relief for two climatic events which are in two extremes. On one hand, few districts in Sri Lanka, about 6 districts in Sri Lanka, is affected by a severe drought. People don't have drinking water. At the same time, another set of districts are affected by floods and landslides. We have never seen such a phenomenon in the history of Sri Lanka. So it's very difficult for people to cope with emerging climate change issues. So we have to therefore come up with new models for community empowerment, and we believe that we have to reform the present primary healthcare system, which is basically which has evolved to cater to maternal and child health needs, but now it has to evolve to respond to non-communicable diseases, aging, reproductive health, and some of the emerging infectious communicable diseases such as dengue. And there has to be a new arrangement with the people and the state. So I'm very happy that the present government is committed towards getting the ideas, suggestions, proposals from civil society organizations in the planning process, and now we are sitting with the top policymakers of the government along with patients' rights groups who have been now given a seat to really sit down with the government officials to negotiate and also be part of the solution. So community-based organizations, CBOs, and the local government authorities, local government bodies need to also work together to address emerging needs. Then finally, I think the technology also offers us a great opportunity to not just to communicate with each other, but also to really do early detection of diseases, communicate with the health administrators using evidence at the ground level. So we are seeing new tools being evolved. Some apps are being developed by young entrepreneurs on disease surveillance and kind of mapping, early warning system. So I think the community engagement with the state to address the emerging issues can be enhanced by use of technology. So, in combination of with combination of technology and people's willingness and also legislative framework, I think we can still maintain Sri Lanka's status as a country which has achieved a good health status with a relatively, comparatively low per capita income.